somehow, in many ways, this is how the diagnosis of adult attention deficit disorder got created. Oftentimes, that diagnosis, when it was first coming out just about a couple decades ago, it almost reliably was with women who were multitasking. The idea was that there were so many things that women were being asked to do that they couldn't keep a handle on everything. And it seemed like they had an attention deficit, was at least one way to explain it. Another way to explain it is like understanding that the world is actually asking you to do an inordinate amount of things all day long. And it's typical and it's reliable, and there's nothing wrong with you for having difficulty staying on that plane and taking care of all the responsibilities that it takes to be a woman in in the present day and age in modern Western society. So, and then a little voice comes in the head, and that little voice is there all the time. It's been there all the time. It's been there since you were a child. It's always there. And if you think it's not there, try shutting it down. Let's go a little bit silent for a moment and see if you can shut down that little voice in your head. Now, that little voice is still there. You might notice that that little voice is saying something like, "What little voice? I don't have a little voice." That's the voice I'm talking about. There's a voice, a little chatter that's going on in your head all the time. And that little voice can get to be pretty disturbing. At times, it can just be chattering and telling you what you should do, or that you didn't do something right, or how are you going to get all these things done, or, like how are you going to manage all the objects in your home, or how are you going to manage all the projects that you're taking on? How are you going to manage all the people that you need to take care of? And then, are you doing a good enough job? Are you actually meeting your own standards? And that little voice, if we listen to it as if it is us, can actually take us off a balance. And that can have us feeling imbalanced, or in many ways, another way to look at that term is the term diseased or unease, if you will, like not necessarily disease, but diseased or imbalanced or in significant discomfort. Now, I want you to get something that I think is very important and is the stand of Welcome to Humanity and the work that I do, Dr. Fred, now as a transformational restorative coach. I no longer am practicing conventional psychiatry. I don't do that anymore because I don't think that it's very effective to actually diagnose people and give them medicines. In most cases, I think the medicines are not the best choice. There's multiple ways to have people actually heal and cure without going down the main street of conventional psychiatry and the treatment and medications that come with that route. So instead, what I want you to get is this following thing that may be difficult for you to hear. And that is, it is entirely possible that there's nothing wrong with you at all. And I mean nothing. Even the part of you that knows that there is something wrong with you, even that part means that there's nothing wrong with you. What do I mean by that? Each and every one of us is pretty sure that there's something actually wrong with us. Each and every one of us has that feeling that there's something wrong with us. So it's actually a sign of normalcy to believe that there's something wrong with ourselves. Now, that may sound like a twist on terms, but it's actually really, really true. Each and every one of us compares our insides to other people's outsides, and it looks like everyone has had their stuff together, has their stuff together, like their day together and their plans together and their thoughts together, and they're getting things done better and more and with more grace or more ease than we do. But the truth is, that's not the case.